discussion by Dr. Hiram Fitzgerald, who will basically discuss a conceptual framework called BirthtoWork, which is being advanced in the capital area as a promising approach for improving outcomes for our community. Before we have that discussion, we put a model here on the screen that pretty much talks about our expected human ecological life cycle. And for layman's terms, this is basically the American dream. And we assume that individuals are born into an ecological system where they will be successful. And they are connected with families, eventually peers. They would receive education, develop some sort of life skills, ultimately gain employment, and hopefully have a career and live happily ever after. But I think many of the data points that we see and the stories that we read indicate that this ecological life cycle is not experienced by all people. And some of the underlying problems that we see exist within our individual domain. We may actually have problems with individuals themselves. We may have issues going on with our families. We may have issues taking place with our peer groups who we tend to socialize with. Our schools may be underfunded or ill-equipped to prepare us for the careers that we seek. We may live in impoverished communities that are not actually contributing to our success. And ultimately, we are experiencing a defunding of institutions that are supposed to support families who grow up in these impoverished systems. And so, Fitzgerald is going to advance an idea that says a birth-to-work framework model may be able to address some of these underlying causes that we're actually seeing. Before comes, I just want to introduce him. He's an associate provost for university outreach and engagement and a university distinguished professor of psychology at Michigan State University. He is co-chair of the MSU Family Research Initiative and executive director of the World Association for Infant Mental Health. His major areas of research include the study of infant and family development in community contexts, the impact of fathers on early childhood development, implementation of systemic models of organizational process and change, the etiology of alcoholism, and broad issues related to the scholarship of engagement. Dr. Fitzgerald.
Okay. What we needed in this area in order to try to make transformational change in the community was a more systemic way of thinking about what we're doing. We have for 45 or 50 years in this country tried to solve our problems by focusing on very small components of the problem, and secondly by focusing on deficits. We know neither of those things work. We've had 45 years trying to solve the war on poverty, and we haven't won that war at all. So we know that the only way we can successfully impact systems is to have more systemic frameworks for doing that. So the BirthtoWork framework developed in the Power We Consortium, which is a consortium of 12 coalitions, 100 agencies, an enormous number of individuals volunteering in this community to try to make transformational change. We're looking at all levels of community systems along the lines that Paul mentioned. BirthtoWork brings the human services sector, state and regional government, business community, the birth to 16 educational system, all around trying to change the lives of every individual baby born in this metropolitan area. We hope that 2020 we will have children, youth, and young adults in our area growing up to be successful. Very simple statement, very difficult and complex goal to achieve. What everyone needs to understand, and really understand at the emotional level, not just the intellectual level, is that every single person in this room, every single one of the 450,000 residents of mid-Michigan lives their entire life on this course. You can be born on this side of the life course. You can be born on this side. Across the life course, we swing back and forth all the time. As I approach my 70th birthday in November, and whatever years I have left, I will move progressively towards this side of the life course risk factor, as will all the other people who age in this country. Okay? So, we don't come and go on one side of the list of the resilient risk continuum that guides our lives, we're back and forth all the time. Along that continuum, there are an enormous number of people that can come in to provide support, to keep us on the resilient side from drifting off to the risk side. We can have community support systems, we have parents, we have neighbors, we have uncles and aunts, good coaches, good pastors, whatever it is, someone comes into our life when we're moving this way and nudges us back to the resilient side. We don't have enough of those people impacting the youth in our culture today. So we came up with this thing. This is the Birth-to-Work framework. It is a conceptual framework to think about what we have to do to impact the acute problems at each of 3 critical age periods, as well as build the sustainable power of positive development across the life course. We have transitional influences at each of these age periods. The age periods are birth to 5, 10 to 14, and 18 to 25, although those are not fixed age periods. We know from neurobiological, brain development, the hormonal systems, all the mechanisms that guide the biology of us, we know that they are in formative development during the birth to 5 years. We also know they are critical for 2 particular aspects of development: self-control and executive functions. And I'm just going to give you a quick read of a study that I pulled off the web today at noon in between events. It's not yet published, but it will be published shortly. It's a study of 1,298 children from the National Institute of Child Health, Human Development, National Study of Child, Youth, and Development. The question is, what are the critical factors of school success? Okay? 1,298 national random sample of children. What are the factors that predict school success? Higher self-regulation, self-control, predicted higher math, reading, and vocabulary scores when you parcel out the influence of ethnic minority status, low maternal education, low family income, and chronic depressive symptoms. Those 4 critical risk factors we know do not provide a good context for early childhood development. But when you parcel those out, those influences, we get children who got it together emotionally do better in math, reading, and vocabulary. Why? 4 critical skills that will provide every opportunity children need to be successful in elementary school. They can listen, pay attention, follow instructions, and persist on task. If you have those 4 skills, and they develop neurobiologically and in the context of your rearing environment, you'll be prepared for success in elementary years. You make it through elementary years, you get hit with another whammy. Every one of us gets hit by it. We know it most personally by our secondary sexual characteristics. Our bodies change, but our brains change too. And the hormonal regulatory systems that influence us change as well. And one of the interesting changes is the reward system of the brain develops a little earlier than the self-control system of the brain. Okay? So earlier in the preteen years, we are risk takers, and things that really get us going drive us out of control, but they feel good. And later, at the end of puberty, the self-control systems of the brain begin to kick in, and all of a sudden we can draw back and begin to evaluate the risky kinds of things we're doing. Another stepping stone, and we need much more support systems in place to help make that transition so you can be successful as an adult in our society and benefit from it. So that's the framework we have. It's a framework that if you're a business person, a parent, a school teacher, a human service worker, whatever you are and whatever your role in life is, you can wrap around every single child throughout the life course and help that child's family, that child's neighborhood, that child's community, and this mid-Michigan area move towards more successful outcomes.